hope you all are doing good. I hope you all are healthy, because being healthy is very important, and this is what is our intention, our purpose. Our aim is to keep you healthy through these videos, which we hope will be useful to you. So today again we are going to talk about a very important disease, diabetes mellitus. Very important because it's spreading very fast. There are a lot of patients who are now suffering from diabetes. Earlier it was the older patients, but now we see because of various factors, even younger patients are falling prey, or they are also having this disease. Not only we'll talk in brief about diabetes, but we'll also talk about its treatment, because diabetes is a disease which provides a lot of options to the physicians, because the multiple steps in which diabetes comes up, and therefore it presents to the physicians multiple steps which they can target, so that the blood sugar levels which are elevated in diabetes patients can be controlled effectively. The drug that we are going to focus today is we use very commonly nowadays, but it's a fairly new drug compared to other drugs that are used to treat diabetes. So today let's start with talking something about what happens in diabetes. In diabetes, as we know in Hindi or in common parlance, it's called as shakkar ki bimari, sugar ki bimari. So it's primarily because of increased levels of blood sugars, or sugar levels go high at a consistent rate in the blood, and this leads to various complications, because then high sugars affect many important organs like the brain, kidney, the eyes, heart, etc. Every organ can be affected by diabetes. So sugar, and we can also talk about sugar and glucose, because these two terms are used interchangeably. And sugar is a very important fuel for all the cells of the body, because besides sugar we also have oxygen, we have hemoglobin, we have proteins, nutrients, so many other things, but sugar forms a very important nutrient for the cells of the body. But it is important to remember that it has to be present in the body in an optimal or optimum level. It cannot go too high or it cannot go too low. Both the extremes would be difficult for the patient. So when the blood sugar levels go abnormally high and remain high for a long time, that is what leads to the disease called as diabetes mellitus. And as we had said in earlier videos, mellitus is a Latin word which means sweet. Blood sugar is basically kept under check, or is controlled by one organ in the body, that is the pancreas. This organ is a soft spongy organ which is present just around or maybe just behind the stomach, and this organ plays the most important role. There are also other organs that we'll see later on, but pancreas plays a very important role in controlling blood sugar level. And this it does by secreting two chemical substances. One is insulin and the other one is glucagon. Insulin is released or secreted when the blood sugars go high. When the sugars go high, so what insulin does, it allows the cells to take in the sugar inside them, and therefore generate energy for the cell or for the organ and for the body as a whole. Whenever blood sugar levels go down, that is the level when another chemical substance is released called glucagon. So what it does is, at times when the blood sugar levels are high, the extra sugar that is available is stored by the body in main organs like the liver, the muscles, and adipose. There is a tissue called as adipose tissue, which we will not focus much. So just remember the liver and the muscles. So the extra glucose, extra sugar, is converted into another substance called as glycogen. So whenever the blood sugar levels go down, body secretes glucagon, and this glucagon then stimulates the liver and other organs where glycogen is stored, converts glycogen into glucose and gives it back into the body. Now, as I said, pancreas plays the most important role. So besides the pancreas, the kidneys, the blood vessels, and also the stomach, the gut. In medical terms, we call the stomach and intestines collectively as a gut. So the gut also plays an important role in regulating blood glucose level. And how it does this? It does this by again secreting. It's all about a chemical mechanism. So it releases chemical substances called as incretins. These are called as incretins, and there are, so we just have to remember that incretins are of two main types. One is, in medical terms, we call them as glucagon-like peptide, or GLP-1, and the other one is GIP, that is gastric insulotropic peptide, that is GIP. Now, to make it simple, what we need to understand is that the ultimate goal of this GLP will focus on GLP only, because that is what is important for us to know. So there is a series of chemical reactions which happen, but ultimately what it leads to, what we want you to understand and remember, is that it stimulates the pancreas to release or secrete or produce more insulin. As if you remember, we said insulin is released whenever the blood sugar levels go high. So once the pancreas secretes insulin, the blood sugar levels go down, because the sugar is sent into the blood cells of the tissues. So then ultimately it leads to the blood sugar levels getting controlled, and thereby helping the body to utilize the glucose in a proper manner. As we said earlier, diabetes is a multifactorial disease, because there are many factors which are involved. So not only this mechanism, but also the patient's age, the patient's body weight, hereditary factors, whether there is any family member that is affected. It could be from the mother's side, from the father's side. It could also skip one generation. But what happens, all these factors collectively, your lifestyle. Now currently, our lifestyle is such that it has become more sedentary. The food that we eat is more processed. We don't move around much. So what happens is that we are getting prone or becoming vulnerable to diabetes, because we have so many other factors that are playing against us, and which make the environment, conducive for the patient to develop diabetes mellitus at a particular age or at a particular time, and that we can't say. So when a physician aims at managing diabetes, so he or she has to take all these factors that we just elaborated into consideration, because just looking at one factor will not effectively control diabetes. If you just look at the patient's age or the patient's body weight, it will not help. We have to look at the patient and at the disease in a holistic manner. So whether the patient or not only these factors that we said, but additional factors like whether the patient is having any other diseases affecting the kidney or the stomach or the heart or the liver, brain, etc. As we just mentioned, that kidneys and the stomach, intestines, and blood vessels are also involved in controlling the blood sugar levels.